Will polio be eradicated worldwide? The World Health Organization declares a major victory against the virus in Africa, but it's still crippling children in Afghanistan and Pakistan. Are there lessons to be learned in the battle to control the coronavirus pandemic? This is Inside Story. Hello and welcome to the programme. I'm Imran Khan. Polio used to paralyse and disfigure tens of thousands of children every year, and some didn't survive. But major strides have been made in eradicating the disease. Much of the world is now polio-free, including Africa. The continent's last case of naturally occurring polio was reported in northern Nigeria 4 years ago. But the campaign in Borno State to immunise every child was attacked by Boko Haram fighters who killed and abducted health workers. Some children can still be struck by a rare form of poliovirus. It mutates from the polio vaccine and can then cause an outbreak in communities which haven't been immunised. Let's have a look at the global fight against polio. The disease was common until a vaccine was discovered in 1952. But it wasn't until 1988 that a global initiative to eradicate polio was launched. 30 years later, reported infections decreased from 350,000 annually to just 33. And while there's been success in Africa, naturally occurring polio virus is still spreading in Afghanistan and Pakistan, with 87 cases reported this year. Kamal Haider reports from Islamabad.
Situated on the outskirts of Islamabad, this is the nerve center for the eradication of the polio virus here in Pakistan. Just Afghanistan and Pakistan are now the two remaining countries. Pakistan's battle against polio began in the mid-1990s. However, Pakistan has suffered many crises, including the Afghan war and the blowback effects of that. Also the fact that Pakistan's tribal areas along the Afghan border were cut off for many years because of the conflict there. The program also suffered a setback in 2011 after a fake CIA-led immunization program was used to detect Osama bin Laden's whereabouts. That gave an excuse to some of the groups fighting against the government to start targeting polio vaccination teams. Dozens have been killed.
Police is committed to the cause of this polio eradication campaign. These are the sensitive areas and there is a past history of attacks on these polio workers and even the security forces. So as a precautionary measures, we are providing security to these people. Areas like North Waziristan and South Waziristan, we have successfully conducted this campaign. Microscopic minority of some people who are against this campaign, but they have been censured, and now I think this challenge has been diminished or has been contained to the larger extent.
This is one of the most intense operations in the world, involving tens of thousands of people.
We are having a large-scale campaign which covers 130 districts in Pakistan. In this particular campaign, we are targeting about 34 million under 5 children. The plan that we have, basically we say that in 2020 is a year of consolidating the transformation that I just said, and inshallah ta'ala we will make 2021 as the year of interruption in Pakistan.
What is important to note that while Pakistan was making progress till March, the COVID-19 pandemic was another setback, raising fears of another spike.
Let's bring in our panel. In Atlanta, in the US, Dr. Hamid Jafari, Director of Polio Eradication at the World Health Organization's Eastern Mediterranean region. In Lancaster, in northern England, Derek Gatherer, Virologist and lecturer at Lancaster University. And in the Philippine capital, Manila, Suzanne Mercado, Strategic Advisor for the International Federation of the Red Cross and Red Crescent Societies in Asia Pacific. Welcome to you all. I'd like to begin in Atlanta with Dr. Hamid Jafari. Firstly, it is a point of congratulations that you've managed to eradicate polio in Africa there, certainly a very big job. But tell us, what were the challenges in particular within Africa, and what was the real turning point for you that you knew that you could be able to eradicate the disease?
First of all, really a massive congratulations to Africa. It has been a tremendous and enormous effort that the countries and the governments and the GPI partners have put in that continent, which has led to this amazing achievement. Of course, what it means for Africa, that at least the threat within the continent of wild polio virus of all three types is eliminated, and hopefully forever. The threat, of course, remains to some extent as long as there is wild polio virus anywhere, which is right now, as you said, is now only in Pakistan and Afghanistan. But I think this is an extremely important milestone, not only for what it means for Africa, but also what it means for the Eastern Mediterranean region, particularly the two remaining endemic countries of Pakistan and Afghanistan. Of course, the pressure, as it were, will go up on these two remaining endemic countries to really meet these final challenges of eradication in Pakistan and Afghanistan. But it also instills enormous confidence in the overall program because of the kinds of challenges that existed in Nigeria that have been overcome, both a period of enormous social rejection, population due to misconceptions around the polio vaccine and polio program, rejecting the program, attacks on health workers, and then a massive conflict, armed conflict, and civil unrest, particularly in northeastern Nigeria, which the program, with the commitment of the government and partners, has been able to overcome. And that instills a great deal of confidence for what is possible and achievable in Pakistan and Afghanistan.
Well, let's talk about Pakistan and Afghanistan. Dr. Hamid Jafari, what we're really looking at here is a failure of politics and political will in Pakistan or Afghanistan, or are we talking two countries that are simply too big, too complicated, too wild, too remote to actually administer an effective eradication program?
Well, you know, it's important to put all of this in context. When we were struggling to eradicate polio in India, there were many voices that said, given the size of the country, the social complexities, and then we also faced rejection by certain minority groups of the polio vaccine. There again, after the success, it was demonstrated that it is biologically and technically feasible to eradicate polio from the guts of more than 1.1 billion people in a country. So that's in terms of the size. And that through appropriate community engagement strategies, becoming one with those communities, you can actually partner with them and overcome the social challenges. The Nigeria program is in some ways showcasing the same success now, that in Afghanistan, the major challenge for the program is right now access to children that live in the areas that are controlled by the Taliban, where the polio vaccination is banned. Nigeria had similar challenges and problems of access in parts of Nigeria and northeastern part of the country, and important lessons have been learned there on how in the setting of limited access still vaccines can be delivered. So there is really, it creates a lot of optimism in the program that the learnings are happening from these large complex countries. In Pakistan, the major issue right now is not the lack of political commitment. There is substantial political commitment. But what is needed is to, again, engage and build bridges with these communities who are rejecting in certain pockets of Pakistan that are rejecting polio vaccination. And a lot of work is needed to listen to these communities, involve the community members and community leaders in the delivery of the program more systematically. And clearly, what we have seen in the context of COVID-19, both Pakistan and Afghanistan, there has been a true all-of-government mobilization, all-of-society mobilization to counter the COVID-19 pandemic. And we are learning lessons from that as polio eradication campaigns, mass vaccination campaigns are being resumed now in the setting of the COVID, that what lessons can be learned from this intense political mobilization in Pakistan, and how the political and administrative setup can really up its game from the lessons that have been learned in the COVID-19 response, working with the polio program so that that same national momentum can be applied to polio eradication.
I will get to my guests in Lancaster and Manila in just a short while, but one more question to you, Dr. Hamid Jafari. Pakistan, in particular, was set back by the Central Intelligence Agency and their program of using a polio vaccination worker in the search for Osama bin Laden. People in Pakistan, after that, when they found out, simply didn't trust polio vaccination workers, the program, and they said it was a tool for US imperialism. I mean, how much did that set Pakistan back?
You know, even soon after that happened, important surveys were done by one of our partner agencies, UNICEF, in some of the most affected areas around the time when actually vaccination was banned in the area of North Waziristan, at that time under control of the Taliban elements. In even surveys done at that time, families said that 95% of the families said that if a vaccinator comes to our door to vaccinate a child, we will not reject, we will accept the vaccine. So it is important to realize that the vast majority of families in Pakistan are accepting the vaccine when it is delivered to them. There are very well circumscribed pockets in parts of Peshawar, southern Khyber Pakhtunkhwa, parts of Karachi, parts of the Quetta, Balochistan area. There are well-defined areas where there is still misconception around the vaccine. And I think what recently has happened is a bigger challenge is actually a lot of the social media that has sort of conflated with the anti-vaccination movement. And a lot of that social media material is being bombarded in Pakistan to these communities who have had doubts about the program. And their doubts don't come from something that happened, nearly 10 years ago. These doubts come from because these communities are living in areas where there are very limited essential health and civic services. And the only service that comes to their doorstep is the polio vaccine. And that creates a disconnect of trust. And that's what the program is now looking to address, about how we can integrate delivery of essential services along with polio vaccination in these communities.
Well, let's go to Susan Mercado in Manila. This disconnect of trust is something that's not just when it faces not just the polio program, but any vaccination program, people do seem to be suspicious about, particularly within rural communities. What's your experience of that?
Well, in general, in the Philippines, people have been used to the immunization program, although in some indigenous groups, it's not acceptable. But because the polio vaccination is being given through drops, then it's less threatening. So I would say that people don't really resist it.
Now, Derek Gatherer in Lancaster, you're a virologist and a lecturer on these things. How much of this kind of global anti-vaccination mindset seems to be spreading? If I just look at my social media, I am seeing people criticize every single vaccination program, and it seems to be getting more and more popular. The science seems to be losing.
Well, we know that vaccine hesitancy is spreading in many places, and we don't really know what the full reasons are for vaccine hesitancy. Many studies have been done that have attempted to dissect the reasons that people have for refusing vaccines. And it seems like as if sometimes when people are on the fringes of society, frequently there are people that hold extreme political views of various kinds, both extreme right-wing political views and extreme left-wing political views. Frequently, there are people that belong to minority religious groups that may have certain rules about their conduct and certain medical procedures that they'll allow. Also, we find that both very poor people and very rich people tend to be more vaccine hesitant than people in the middle. So it's really difficult to tease out the reasons why vaccine hesitancy is growing, because it isn't a single group of people in society that are moving into this mindset. It seems to be a wide variety of people, in many cases with completely different social circumstances and completely different belief systems, but they're latching on to this idea that vaccines are not good for their children. So there's clearly a lot of important work to be done on the psychology of vaccine hesitancy, and also planning how we can best get the message across.
Suzanne Mercado, the next biggest challenge is going to be the delivery, when it eventually arrives, of the coronavirus vaccine into remote areas. Is there anything that you may have learned from the polio eradication program that prepares you for something that will be a mass event in the world?
Well, the experience in the Red Cross movement is that once you engage community leaders and you get the community involved in the planning of a vaccination program, then you're bound to be more successful. And we've seen that in, supplementary immunization projects that have happened within the ambit of Red Cross societies. So preparation really involves that grassroots, localized leadership of individuals who understand how to communicate and how to mobilize mothers to bring their children for vaccination. The same will be true for COVID. We will only be successful with a COVID vaccination if we are able to properly engage with communities.
Derek Gatherer, but the polio vaccine was one thing. You were able to get lots of people into a large space. You were able to, give them the polio vaccination. With coronavirus, we're going to have to socially distance. There's going to be real security and practical challenges in trying to deliver the vaccine when it comes, and to try and stop the virus from spreading when that many people are gathered together. Are there unique challenges then with COVID-19?
COVID-19 is already causing problems with many normal medical activities. We know here in the UK that hospital appointments for various long-term conditions have gone down, that there have been reports that people haven't been receiving cancer treatment and so on. As far as vaccination is concerned, also the polio vaccination programme has been affected this year. The World Health Organization have said that both the monitoring for cases, so this is done by looking for cases of paralysis in children, so that's the monitoring part. And then there's also a more population surveillance part, which involves testing sewage and fecal samples for traces of the virus to see whether the virus is circulating in a community. So both these clinical surveillance and laboratory surveillance activities that are connected to monitoring where polio might be spreading have been impacted by COVID-19. They're simply not happening at the levels that they need to. So yes, it's possible that COVID-19 might throw a spanner in the works yet of our ongoing efforts to completely eradicate wild polio virus type 1 in India and Pakistan, and indeed to prevent it from coming back to other parts of the world like Africa. It's important, I think, to emphasize that even if we do get to eradication, I mean, last year we had 175 confirmed cases of polio, wild polio in the entire world. And that's down from hundreds of thousands about 3 decades ago. So it's enormously successful. But nevertheless, we're going to have to keep vaccinating people, because there's always the possibility, as long as there is some polio circulating, that it will find its way into a susceptible population. Once you stop vaccinating, you have new children being born, and they're coming in, and they're not immune, and the herd immunity level will drop, so that the proportion of people in the population that are immune will come down, and eventually will reach a level where polio, if it can find a susceptible population, will start to break out again. So it's really important that we keep on vaccinating for some years now to make sure that all the polio is gone and everybody is vaccinated until that time arrives.
So vaccination has to be the new normal. Dr. Hamid Jafari, are there lessons to be learnt, case studies, anything? Because we are a long way away from a COVID-19 vaccine. But in terms of how you operated in Africa, how you operate in the rest of the world, are there lessons to be learned for when eventually, and right now, dealing with COVID-19?
You see, the kind of fear and panic we are seeing now with COVID-19, the same kind of panic existed in the US and around the world when these outbreaks of polio were happening and there was no vaccine. And a vaccine was developed and massive trials were conducted. And then there was vaccination done, and it has changed, obviously, the whole face of and the threat of polio. But we have also learned, both from polio, and we will learn this with all other vaccines and with COVID vaccine, that a vaccine is no good if it keeps sitting in the vial. It has to be delivered to the most vulnerable people. And I think the history of polio eradication, as my colleague was just mentioning, is that we've come from, hundreds of thousands of cases each year to less than a couple of hundred wild polio virus cases, is because of the success of the vaccine. And I think we have learned very important lessons as to how to deliver those vaccines in the most difficult areas or where there is lack of trust, and the kind of challenges that the polio program has been faced with and is consistently successful in overcoming. And that's why today's news is so important of Africa becoming polio free. None of the problems we are seeing in Afghanistan and Pakistan are some things that we have not seen in Nigeria or other parts of the world. Obviously, the solutions are unique, but we have the confidence to overcome them. I also wanted to make a couple of comments on your question about the impact of COVID-19 on the polio eradication program. And I think already mentioned that it has affected surveillance for polio virus. And we are now working to sort of restore that surveillance. A lot of our polio workforce, infrastructure, and assets were immediately repurposed for the response to the COVID-19. So the polio eradication workforce and infrastructure, highly trained in surveillance, disease detection, in organizing communities, communication, data management, emergency management, have been all involved in the COVID-19 response. But as of July, many of the countries, particularly including Pakistan and Afghanistan, did resume their mass vaccination campaigns with very important precautions. So that, for example, only including workers who were from the local community, so that they don't bring infection from outside into a community that may not have COVID-19. Every worker was screened for symptoms and fever of COVID-19. Each worker was given personal protective equipment.
Sorry, Dr. Jafari, we are running out of time, and I would like to get to some of our other guests as well. Sure. Suzanne Mercado, you heard there about the idea that the infrastructure was used to deal with COVID-19, but you're a strategic advisor. Underpinning all of this is funding, money. COVID-19 has provided you with an immense challenge. Is there enough money and enough will to keep a COVID program up until we get a vaccine?
I think that's going to be very challenging. I mean, COVID has hit both the developed and the developing countries, and donors who usually had enough to give to the developing world now are going to be holding on to their own resources, whether those are vaccines or human resources, for their own needs. So I think we are really up against a huge challenge in terms of bringing the vaccine to the most vulnerable in the quickest possible way. So I do believe that financial and other resource restrictions are going to make it very difficult for poorer countries to get the vaccine and to use it effectively.
Dr. Hamid Jafari, just very quickly, the WHO has a funding challenge. It is, if not running out of money, then it will run out of money at some point in the next 12 months when it comes to if there is another outbreak of COVID-19. Well, what are you going to do about that?
So, I think this really highlights the so far extreme underfunding in public health capacity development and dealing with emergencies in countries around the world. For the polio program, obviously, we've taken a setback as the virus is expanded during the time when the vaccination campaigns were suspended. So the cost of the polio program has gone up. But I think the COVID-19 brings an opportunity also of better integration. Clearly, public health is now at the center of the economic debate as well. And we are optimistic that this COVID pandemic finally will bring an opportunity where there will be sufficient investment in basic public health service delivery, and also the programs that can leverage the polio eradication infrastructure, the vaccine delivery mechanism, to provide more integrated services, and so that you would have multiple streams of funding supporting integrated programs.
I want to thank all our guests, Hamid Jafari, Derek Gatherer and Suzanne Mercado. And thank you too for watching. You can see the programme again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. And you can also join the conversation on Twitter. We are at AJ Inside Story. From me, Imran Khan, and the whole team here in Doha. Bye for now.